Assalamu alaikum. The study is titled With Outcome of Direct Pulp Capping Using Calcium Hydroxide. It's a long-term retrospective study by Ricucci and his group, published in 2023 in Journal of Endodontics. The main cause of pulp pathology is advanced caries lesions and mature teeth with deep caries lesion that exposed the vital pulp can be managed by attempting to preserve the pulp through pulp capping, pulpotomy, and pulpectomy to prevent further necrosis, infection, and apical periodontitis. Previous studies reported unpredictable outcomes for vital pulp therapy, and they recommended only for immature teeth and those accidental traumatic pulp exposure. The recommended alternative approach to direct pulp capping in teeth with deep caries is indirect pulp capping, but this mostly based on the principle that caries can be arrested if the ecology of the involved bacterial biofilm is altered. Total excavation and the treatment of the exposed pulps have exhibited a high success rate in teeth diagnosed with reversible pulpitis and even in irreversible pulpitis cases. So this study aims to evaluate the long-term outcome of direct pulp capping in mature teeth using specific case selection and the treatment procedure, and also to evaluate the influence of multiple factors on the treatment outcome. Cases receiving direct pulp capping treatment over a period of 15 years and were followed up for up to 35 years. Only cases diagnosed with reversible pulpitis were included in this study, and the criteria was no history of severe spontaneous pain, short episodes of mild or moderate discomfort, mild or moderate sensitivity to cold or sweet stimuli, pulp sensibility test within normal limits, negative results to percussion and palpation, and radiographs showing normal periodicular conditions. Regarding the clinical procedure, caries lesion were removed completely under rubber dam isolation. 1% sodium hypochlorite was used to disinfect the cavity, exposed pulp, and for hemostasis. Cases with bleeding could not be controlled within 10 minutes were excluded and scheduled for pulpectomy. Teeth with a small pulp exposure were permanently restored at the same visit, and for those with large pulp exposure, the cavities were temporarily restored with zinc oxide cement, and the patients invited to attend after 3 to 6 months for observation and permanent restoration. The size of the pulp exposure was recorded as small if the size less than 1 millimeter, and it's considered medium if the size of the exposure 1 millimeter, and it's large if the pulp exposure is more than 1 millimeter. Regarding the follow-up, the treatment was considered to be successful when the following factors were observed. The patient reported that the tooth was comfortable and functional. No sinus tract or gingival swelling was observed. The tooth was not mobile or tender to vertical and lateral percussion. Also, if the tooth responded to cold and electric test normally. The radiographic examination, absence of periodicular changes or root resorption, and irregular calcification in the canals. Based on radiographics and the clinical inspections, the quality of the restoration was assessed as inadequate, adequate, or new caries present at any point along the margins of the restoration or in another area of the tooth surface. 225 teeth from 148 patients were available for follow-up examination in at least one of the evaluated periods. Gender and age were not significantly associated with the outcome in any of the periods evaluated. The most affected teeth were mandibular and maxillary molars and maxillary premolars. The main factor associated with the treatment outcome in all follow up periods was the quality and the presence of the coronal restoration. The success rate of the direct pulp capping procedure was 100% after the 1 year and 95% after 5 and 10 years and 86% after 20 years and 89% after 35 years. At 5 years follow up, the proportion of failures in teeth with large exposure was higher than ones with the small and medium exposure. At the 20 and 35 years follow up, the proportion of failures in teeth with medium exposure was higher than the group with small and large exposure. They concluded that a very high success rate of direct pulp capping of teeth with reversible pulpitis using calcium hydroxide, especially in the first 10 years following treatment, and the quality of the coronal restoration was the main factor that influencing the result.